Okay, so let's go over a 4-point cervical MSR protocol. These are the same procedures that I use in clinic every day, and I found that they work really well for resolving a lot of chronic issues. Really helps to work into the kinetic chain and release a lot of different structures. Okay. You okay there, Mickey?
Yep.
Good. So why don't we start up on the shoulder over here. Okay. I'll just get the camera to come over to this side a little bit so you can actually see what I'm doing here. I'm just going to do maybe 2 passes on the shoulder here first before I even get on the neck, just to release it a little bit. You okay there?
Oh, yeah.
Good. Good. And out and across. Doing okay there?
Oh, yeah.
Good. Feel that. Across and out. Here. I'm going to start out with a broad contact first. And we're going to move into lateral flexion. And I'm just going to bring a little bit of rotation into there. You doing okay?
Oh, yeah.
How's that feel?
Really nice. I feel like I'm actually going to be able to get more range of motion in my neck.
Okay. I can feel that right there, a little bit of a restriction.
Yeah.
So I'm actually going to move from a broad contact here, getting on the thumb, and not just going straight into a vector, but actually using rotation again. Doing okay there?
Yeah.
You can actually feel that a little bit easier, can't you? Okay, over and down. So let's do a little bit on this side too, because I don't want to leave you imbalanced. Good. Oh, that's tight.
Yeah.
Really tight. Wow. That's a little region. Good. But if you go just in a straight line, completely linear, it's not going to do as much as if you actually get some rotation in there. Creates a little bit of torque. Now that we've addressed some restrictions in the lateral cervical spine, let's get on the anterior. Mickey, you okay with me working in the front here? I'm going to need to get on the clavicle in the front here. Okay. What I'm going to get you to do as I go through this process, we're going to actually go through different vectors. We're going to start out this area here. You're going to bring your head up and back fairly slow, over a little bit, and up, right to center, taking it right up and back. You okay?
Oh, yeah.
That's tight, isn't it?
Yeah.
Okay. And down. Good, perfect. Take it up again. And very conscious of feeling for pulses, moving in and taking it up. You okay there?
Oh, yeah.
And back. And over, yep. Again, up. Over. I'm going to get more towards scalenes. Getting towards the sternocleidomastoid. There we go. A little tight there, eh?
Oh, yeah.
Yeah. All right. So I'm not pinching really hard, even though I know this is pretty intense for Mickey. Okay. And up. And also getting up towards the mastoid process here. Now let's talk about releasing restrictions in the posterior cervical region. So, again, I'm going to get on here and kind of take this down a bit here. You okay with it? Too much, or
No,
you okay?
Perfect.
Now let's just go through that little action where we make it like a rooster. So bring your head forward, okay, back, bring it forward. There we go, and back. Okay, so now, not too fast. Bring it forward. I'm just going to go chin up a little bit. There we go. You okay?
Yeah.
And back, and again. That releases quite well. Now I want you to kind of do the same thing, but go at an angle like this a little bit. Out. There we go.
Oh.
And again. Okay, and again. So we're getting that motion in there. Now take your chin towards your shoulder on the right. So drop it down. No, down like that. There we go. And back. Okay, so there's one area here we need to discuss, is that there are a lot of connections between the suboccipital region here and the front of the head here. So we have the suboccipital muscles, the frontalis muscle, and we have the occipital frontalis, which is basically thick connective tissue or fascia, goes right underneath the hair. There's a good reason why in acupuncture we have a lot of neurological connections in this area, a lot of acupuncture points all over here. Very, very powerful work can be done up here. And one of the ways of actually accessing this without putting needles in the area is to use the hair to actually work on the area. Okay, so Mickey, you okay with me up here? Working up here? Okay, take this up. I'm going to pull this down here. Okay. I know your patients may look at you a little crazy and you go, I need to pull your hair to actually access this area here, but it really does work. Okay, so Mickey, I'm going to get you to actually loosen your hair there a little bit because I need to get up and actually stretch some stuff out. When we've done some traveling in China, Thailand, a few places, and they're doing head massage, they're actually fairly aggressively getting in there and actually pulling the hair. But we won't go too hard. You okay?
Yeah.
You feel like quite a bit?
Yeah.
Yeah. I feel okay?
Yeah.
Yeah. I always tell patients that I'm pretty good at actually getting rid of headaches and releasing tension in the area, but I'm horrible when it comes to hair. Good. So I'm going to get in there and you kind of pull it right up and just kind of hold. You okay?
Oh, yeah.
Head down. Grab it, pull, hold. Okay. One more time. Pull, hold. Perfect. Okay. So the last aspect of this video that I would like to cover is joint mobilization and manipulation. It's not good just to address restrictions within the soft tissue without considering the joints and vice versa. So, Mickey, we're just going to go through some standard mobilization stuff here first. You doing okay there? Mm-hmm. Okay. Get right up. Good. So we're just going to do a little bit of stair stepping here. And then I'm going to take your head around through motion. And I'm looking for restrictions in each of the facet joints in here. Doing okay there?
Oh, yeah.
Good. Especially a little tighter as we get higher, doesn't it?
Yippers.
Okay.
Especially on that left.
Yeah. And I'm going to just sort of take each particular section and kind of get in there a little bit. There, yeah, right there. Oh, I can really feel that. So sometimes I can release a restriction with mobilization. Other times, if it's in with your scope of practice, it's going to require manipulation. Okay, right there. Yeah, I can really feel that. Let's get on this side here, working your way around. Doing okay?
Yeah.
It's really tight on the left today.
I know. I don't get it.
Okay. Take a deep breath in. Let's just breathe out. It's just traction a little bit there. Is that feeling okay?
Yeah. I can feel it all the way down into my sacrum. Oh, that's weird.
Breath in. And out. Right out. It's really good if you can use breath to release the structure. So just get the patient to really breathe in deep and let it out slowly. Good. Okay. There's a few things here that actually need to be manipulated. You're okay with me adjusting the area here?
Oh, yeah.
Okay. Let's get up in here. Okay. I'll get you to come in a little bit closer here, Steve, so you just kind of see what I'm doing here. Down, let it drop down. There we go. Perfect. Let this relax here. Take it down there. Perfect. Okay.
Oh, I can look over my shoulder.
Huge difference there. I'm just going to check out your mid-thoracic area because usually there's compensations there. Okay, so just slide down a little bit here. Excuse me. Grab the shoulder here and here. Roll the side here. Good, good. Take it over. Right down. Drop, drop, drop. One more time. Drop. There we go. Drop again. Perfect. Okay, come on up now. Great. Okay, Mickey, move your head around.
Oh, yeah.
After doing all that work, how does that feel now?
I could not look over my shoulder.
Bring your head back, just rotate it. Does that feel a lot looser though?
Totally different, yeah.
Yeah, good, good, good. So these are just some of the things that we can incorporate in a treatment. It's not just about the soft tissue, it's not just about the joints. Combine things together and this becomes extremely powerful work.